welcome to another quick blog summary from the Cancer Physio. Today we're going to talk about a recent blog on managing hormone therapy in breast cancer. So sometimes breast cancer can turn out to be hormone positive, which means it's sensitive to estrogen or progesterone. And in that case, usually one of the final steps in treatment is to undergo some form of hormone therapy. So this blog will talk about the most common symptoms and then also tools to manage those symptoms and side effects. So we know that hormone therapy is often, like we said, kind of the final step. And that sometimes when we take that hormone therapy within the first few months, because of that kind of sudden drop in hormones, in particular estrogen, there can be symptoms that come to the surface very quickly, such as hot flashes, kind of feeling flatlined, feeling nauseous, or having a lot of pain and fatigue. And so this blog will break down some of those symptoms and side effects and what you can do about them. Quick overview on the types of hormone therapy: aromatase inhibitors, otherwise known as AIs, most commonly known and prescribed as aromasin, anastrozole, letrozole. That might kind of ring a bell. This tends to be for kind of post-menopausal women. That's the population that is prescribed to. Steroidal hormone receptor blockers, or ERDs, otherwise commonly known in the class or brand of tamoxifen. This tends to be more of the premenopausal population, is another form or classification there of hormone therapy. And then of course we can go a little bit down into the integrative oncology world, where we look at kind of natural estrogen suppression and alternative medicine. And you can kind of expand here in my blog to read more about different kind of natural supplements and foods that can help, and some recent studies in bioidentical alternatives, where this kind of area is looking at how you can get some of the benefits of hormone therapy without the symptoms and side effects. So feel free to kind of peruse that area of the blog a little bit, and then consult with your care team or registered oncology naturopath to learn a little bit more about those options. So one of the first things that is very important, I always say, for patients to think about is the hormone therapy and the associated risk reduction. For patients with different types of breast cancer, different stages, different grades, HER2 possibility, etc., and the genetics, there is a particular statistic or percentage with which the hormone therapy will reduce your risk of reoccurrence. And I always think it's very important for patients to know that statistic. This can help you make a more informed decision, and that's always ultimately the goal, that you make a well-informed decision as to whether or not the possible symptoms and side effects of hormone therapy outweigh the reduced risk of reoccurrence. So I always ask that patients get that information if available to them. And this can help them make a more informed decision. So let's unpack a little bit some of the common symptoms and side effects of hormone therapy. I think first and foremost, it's really important to know that typically research shows that the first 3 months, symptoms and side effects are the most significant. We see that kind of rapid drop off of estrogen often, particularly like with the AIs. It's about a 70% reduction almost immediately, and progressing on to even more of a suppression of estrogen. So that can be correlated with a pretty strong onset of symptoms and side effects for some. Once again, it's really important to highlight that all of these cancer journeys are heavily personalized, and I always come back to that theme. So just because you see that or heard that someone said their journey on hormone therapy was terrible does not mean that you will have any trouble at all. But research does show generally symptoms and side effects are the strongest in those first 3 months. So some patients will kind of give the hormone therapy a 3-month trial period to see kind of what it's like, wait for that 4th or 5th month, and often things can rapidly drop off or stabilize, and things can feel a lot more manageable. So one of the most common side effects that's reported is just that generally with that decrease in estrogen, exercise can feel hard. Estrogen is very important in helping our muscles find food. The estrogen can help the muscle essentially kind of get glucose and use it. And so sometimes all of a sudden with the onset of hormone therapy, patients will just feel like exercise is not well tolerated. They're kind of overheating. They're feeling really tired, and there's very poor stamina. This is very normal and does occur. Another symptom that hormone therapy can lead to, therefore, is fatigue. So we often see that, estrogen acts as an anti-inflammatory, a metabolic accelerator, a bone builder, amongst many other things. And so when you all of a sudden decrease that hormone, that can lead to just kind of feeling quite tired, poor stamina, etc. I'll break down some tools to better manage this later in the blog here. Of course, throughout this blog is a lot of links that you can click on if you like. There's a detailed blog available there on exercising with cancer, how to do that safely and effectively. All those questions around intensity and time and type are all broken down for you in that blog right there. So, another big factor is that hormone therapy may lead to hot flashes. And so when people hear the word hot flash, they might just think, oh, onset of sweating. Anyone who's had one will tell you it's very different than that. They will tell you that it's almost a feeling of overwhelm that comes on really rapidly. Your heart starts to flutter, profuse sweating, flushing and redness of the face. It can cause some of my patients to not want to leave the house, and it can feel very overwhelming. So that's a very common symptom and side effect from hormone therapy, once again, for some, but not for all. And so we'll talk a little bit about tools for that. Another common symptom and side effect of hormone therapy, and I would say that research shows that this is the most common reported symptom and side effect, is that patients will feel an increase in joint and muscle pain. You can distinguish this from your typical previous pain or your typical previous osteoarthritis because it will be bilateral. It's both sides. It tends to be both knees or both hips or both hands. And that's how you know that it's related more to the onset from taking the hormone therapy. This is the most common complaint I get in my clinic, and such that we actually have a medical condition for it. If it's quite severe and really impacting someone's quality of life, I would say if it persists beyond those 3 to 4 months of after you've started taking the hormone therapy, we actually call this aromatase inhibitor induced musculoskeletal syndrome, otherwise known as AIMS. And we know that the decrease in estrogen can affect joint and tissue inflammation and can then in turn decrease the elastin and collagen production of the tendons and cause them to lose some of their kind of tensile strength and therefore lead to increased joint and muscle pain. Once again, we will talk about tools to better manage that later in the blog here. Another symptom and side effect that hormone therapy can lead to for some is that there is a drop in dopamine, and that just makes it hard to feel good. Obviously, we've got a little couple things working together here to create that and cause that to happen. When you're thinking about kind of increased pain, you're thinking about a bit more fatigue. These are all things that kind of stop people from moving and exercising. We also talked about exercise in itself, maybe even feeling harder. And all this kind of comes together, a little bit less dopamine in the bank, and patients will just kind of feel a little flatlined. So we talk a little bit about tools as well later in the blog that can help with this. Once again, this blog is highlighting tools that work within the body's ability to produce endogenous opioids and catecholamines, otherwise known as the body's ability to make feel-good stuff. And this can impact pain perception and in turn reduce inflammation and in turn make you feel better. The last one of the last symptoms here is one that no one likes, and that is nausea, which can just make it really hard for patients to feel motivated to do anything at all. This too is kind of related to that kind of drop in estrogen, and so this is a commonly reported symptom by many who start hormone therapy. And one of the last side effects of hormone therapy is that some, not all types of hormone therapy, are associated with an increased risk of decreased bone density, which means kind of poor bone health. Not all hormone therapies act equally here. Your medical oncologist will kind of talk about the associated risk and maybe offer even some other treatments or injections that can help counteract these risks. So there may be options there. So now let's talk about the exciting stuff, which is tools that work. And this is to help manage some of those symptoms and side effects that we listed above. The first one I have talked about in another blog, the Chemotherapy-Induced Neuropathy blog that will be linked below. And this is a really cool and simple tool that can just help to counteract hot flashes, nausea, feeling a bit flatlined. And this is the tool of just cooling your body, otherwise known as cooling your body's glabrous tissue. So where is this glabrous tissue? Big fancy word. Basically, it is the palms, as this photo demonstrates, soles of the feet, and forehead. These are portals into your core temperature. There's a lot of blood vessels that are interchanging kind of in this area, just available to dump heat and available to quickly change your core temperature. So it isn't fanning your face or unbuttoning your blouse that's very effective, but maybe quickly getting your hands on a cold water bottle or putting a wet towel on your forehead or quickly taking your shoes off or putting your feet in a little bit of cool water. Those are the really effective ways to quickly kind of manage a hot flash or cool your body down. The links provided here will elaborate a little bit more on that for those who want a few more tips and tricks around that tool. The second tool that I really highlight here to help with some of the symptoms associated with with hormone therapy is cold exposure. This can particularly help with the feeling of flatlined, with pain, with the feelings of fatigue, and maybe even some of the nausea. The research is the strongest, I would say, for feeling flatlined and maybe evolving a little bit in the world of pain science. So cold exposure is different than just cooling your body down. This would be doing an exercise with which you're actually in a temperature that is slightly uncomfortable. This needs to be done safely and this needs to be done effectively. So I really go into detail about the cold exposure protocol here in this blog, but also in other blogs. You can find a lot of links here where I kind of elaborate and I call it the cold exposure protocol. And I will provide a link at the end of this video where I go into more detail about that protocol. It's really important to do this effectively. I've had patients who just jump off of a dock in a state of panic and then race out and they had a terrible time. That's not effective, nor is it welcoming. The goal is to control your breathing and have done these exercises in such a gradual and safe way that you can control your breathing throughout the entire time and not hold your breath. And you also want to be able to notice your body transition from a state of panic to a state of balance or homeostasis with the environment around it. So once again, links will be provided as they are in this blog where I go into a lot more detail on how to do this safely and effectively. The research does show that if you do this kind of about 11 minutes a week, that's where the research is at right now, random number, could do it in short bouts or kind of in one weekly longer bout, that there is some very clear physiological reactions. One of those is dopamine. Dopamine is a motivational feel-good hormone. So this can help a lot with patients that are finding that they are feeling flatlined, they're feeling fatigue, and so on, and feeling pain. Dopamine is a catecholamine, which means that it has somewhat of an anti-inflammatory effect. So once again, we kind of talked about how that drop in estrogen, which is an anti-inflammatory, can lead to kind of pain, increased inflammation, feeling flatlined. And so cold exposure that increases dopamine can really help to counteract some of those symptoms and side effects. Same with the last tool, get moving, exercise. Well, we highlighted how a drop in estrogen can kind of make exercise hard, so it's a bit tricky, but I elaborate more in my Exercising with Cancer blog on how to do that safely and effectively. Most important is that slow graded approach. You do not want to push crash. That is counterproductive. So maybe you start with pool therapy, some gentle walking, some light resistance training, and you increase that over time. But what we know with repeated movement and regular exercise is that you release the endogenous opioids, you release the feel-good hormones, you release the anti-inflammatory hormones. That therefore helps to counteract that drop in estrogen. So exercise, although impacted, if done correctly, can have a great impact on reducing the symptoms and side effects of hormone therapy. So once again, I hope that's just a nice little summary for you of the blog for those of you who don't like to read or don't have the time to do so. I appreciate your time today. As always, thank you for your interest in science and rehab.